Welcome back to San Antonio Living. This morning, it's all about medical procedures that you can do to help maintain that look, the one that you got that you want to keep. And joining us right now is Dr. Manny Lopez, also his patient, Jenny Hare. Dr. Lopez is a plastic surgeon, and you've seen him here on San Antonio Living before. How are you? It's very good to see you.
Great to see you.
Jenny, thank you for coming. You look fabulous.
Thank you.
You know, I've always wondered about a facelift because I've heard stories, I've seen scars, and I said, you know what, Dr. Lopez, I want to go into the operating room and I want to see how this facelift is done. And thank you very much for allowing us to go in there because it's really interesting, and I can tell that facelifts have come a long way.
Right, yeah, it's my pleasure. Yeah, I'm glad that we can do this and talk about facelifting.
So what would be the reason for a facelift? Because we can do little things here and there. We can Botox, we can do an eye lift, but we're not going to get that overall effect, are we?
Right, so really the facelift's a misnomer. Because a lot of people think that when we lift the face, everything is coming up. When we're talking about facelifting, essentially what we're doing is we're improving the puppet lines, the marionettes.
Okay.
We're improving the jawline, which are the jowls, and then the neck. So really the improvement that you get is a lower face. So even though it's called a facelift, really it's a lower face is what we're doing.
And how long will the results of your facelift last?
Oh, essentially, it really depends on the age. So the younger the patient, the longer the result, because we have better elasticity when we're younger. But in general, a good 15, 20 years. So when you have in your 50s, you're pretty much one and done.
One and done.
Yeah.
I like that a lot.
Right.
Jenny, why did you decide that you wanted to do a facelift?
Oh, I had this sagging area right here.
Yeah.
I just didn't feel refreshed, just looked tired.
And had you tried other things too, little procedures here and
yes.
there? Okay.
Some fillers, skin care lines, things like that, but just didn't get the results.
Okay. Well, I want to show the video because you do your facelifts. You have the option of being awake. You don't have to go completely under, which is a benefit for a lot of people because a lot of people don't like to take that step. And here's you with Jenny. Walk me through the procedure.
Sure.
What are we doing here?
So here we are. So Jenny opted to have it done under local. And the benefit of that is that she's kind of awake during the procedure. She's kind of involved, but she's very comfortable. So here I am kind of numbing her up.
Okay.
And it's using the local anesthetic, very safe. In the different areas, I'm going to make the incisions and the dissection.
Were you nervous, Jenny, at this point?
Not at all.
Not at all. You're in good hands,
I was so
right?
relaxed. I had taken some Xanax, a little Darvocet.
You were good to go.
Feeling good.
At this point.
Feeling good.
Once we, a lot of people, it's your face, you know? And so you really have to make sure that you're putting your face in good hands. And this has been your background for how many years?
Yes, I've been doing facial plastic surgery for the last 10 years, so it's been a while.
You worked a lot on soldiers too,
Right.
and did a lot of reconstruction.
Right.
So you really want to do your research too when you're looking for a doctor.
Absolutely.
All right, let's go into the operating room and see how things go. When you're doing the surgery, about how long does it take?
So it depends on the deformity, but Jenny's took about 2.5 hours.
Okay.
And so it's an extensive operation to get the lift that you want. Again, that one and done. So here I am making that incision in the preauricular area, the area in front of the ear. And you see kind of picking up the tissue and then dissecting under the tissue.
Jenny's in dream world. She's
So Jenny's awake, very comfortable.
Laughing. Or feeling like I was laughing.
You're like, hey, Dr. Lopez, all is well. Don't worry about me. When you're doing that lift, you're going to see the result on your forehead, your eyes, your marionette
The result
lines?
is the marionettes, the jawline, and the neck.
Okay.
So when we're talking again the facelift, we're talking about the lower face. So you won't see an improvement in the upper part. Those are different procedures.
Okay, well, let's take a look at Jenny's before and after picture so you can see the difference of a 2-hour procedure. Here we have the before and the after. What do you think, Jenny?
Look at that.
I know. It is you just look so much more alive here.
Yeah.
So the improvement is in the jawline. So what Jenny's issue was more of the sagging in the jawline. So she felt young, but now she's starting to show some signs of aging. So this is where we see this jawline kind of not be as sharp. The marionettes here be a little more apparent. And then her neck was not a big issue. So here, now we have a nice, sharp jawline, much fresher appearance, and the marionettes are just about gone. So Jenny was a perfect candidate for this type of procedure and did fantastic.
Watch the side view because you can really see a big difference. When we go to the next picture, it's got the side view. Look at the before and look at that jawline on the after.
Right, so here we have kind of an H jowl and jawline, and we have some lax in the neck and some marionettes here. And now we've just given her a fresher look with very well hidden scars that no one would even.
Oh, I know.
Okay, let's talk about that scar because that was my biggest worry. I grew up thinking, oh my gosh, you have to take off your ear and then put it back on to have a proper facelift. That's not the case. So let's look at what you have to do and show me where you do the incision.
Sure. So Jenny had the operation back in January.
Okay.
And so here we are, we make an incision because we don't want to raise this. It's called the temporal tuft.
Okay.
So you don't want to raise this. The sign of a bad facelift is where you have non-hair bearing skin in an area where you should have hair.
Okay.
So for her, I made the incision right here, behind this little piece of cartilage called the tracheal cartilage.
Okay.
Underneath the earlobe, behind the ear, and then back at the hairline. Another sign of a bad incision or bad facelift is where you have misalignment of the hairline.
I see absolutely no scars. I see nothing to tell me that you have had a facelift, and that's what's amazing. Looks beautiful. You look gorgeous.
Thank you very much.
We wanted to show you a couple more examples because women with darker skin have different results. Men have different results when it comes to facelifts. This is another patient with the before and the after. Tell me about what you were trying to do for her.
So again, her main issue is, again, the jowling and the marionettes. And she also had her eyelids done, but that's a separate procedure, so that's where you see the improvement in the eyes. And she has some laxity in the neck. You can see those little lines there, those platysma bands.
And the guys need facelifts too.
Yeah.
And this is a huge difference here.
Right. You know, male patients are coming more and more. I mean, more guys want to keep looking younger. And so this is just a big, heavy neck that through a facelift, you get improvement in the jawline and that neck.
Wow. So. Absolutely amazing. And thank you for allowing us inside the procedure. The result is absolutely beautiful. Thanks for coming, Dr. Lopez. If you would like more information on what Dr. Lopez can do for you, contact Lopez Plastic Surgery. They're on Santero Boulevard. The website, lopezplasticsurgery.com. The phone number there on your screen, it's 495-5771. Again, 495-5771 for more information.